One way to give yourself a self-assessment at home is a great test called the 1/3 knee bend test. If you don't have great balance, you can hold on to something, hold on to a stable chair, stable table. You can even hold on to a wall. So what I'm going to do is I'm going to get my balance on one foot. I took my shoe off so you can see the mechanics of my foot a little bit better. I'm going to get my balance first, and then I'm going to squat down about 1/3 of the way of my full range of motion. It's called the 1/3 knee bend test. And what I'm looking for is my foot alignment. Does my foot wobble a lot? Am I collapsing in? Am I staying neutral? Or am I putting more weight onto the outside of my foot? I'm also looking at my knee. As I'm bending down, does my knee stay right in line with my hip? Or does it collapse in a little bit, which indicates weakness in the outside of your hip? Or is my knee coming out really far, which indicates weakness on the inside of the thigh? So that gives us a lot of information, physical therapy-wise, on some muscle imbalances that we may need to work on and address. Something else that you can look at if you're just standing is what are the alignment of your feet? Are they neutral here? Or do you have a tendency to roll out this way, retroversion? So not only are your feet pointed out, but your hips are also rotated out externally. Or are you pigeon-toed here where your toes are pointing in, which also means that your hips are internally rotated here. So there might be some muscle restrictions here, also some muscle imbalances that we can address with physical therapy. One thing that we will look at here at Loudoun Sports Therapy Center is how your foot is moving, the mechanics of your foot when you're just standing at rest, when you're balancing on one foot, and then with actual dynamic movement. So one thing that we look at is, are you more neutral? Does the back of your heel stay in a neutral position? Or are you more pronated where the inside of your foot and your arch kind of collapse down and you're putting more weight on the inside of your foot? Or are you supinated here where you're putting more pressure and kind of rotating a little bit onto the outside of your foot? That is also going to play a big role in your shoe selection and also with arch support. If you are somebody who has a tendency to pronate and put a little bit more pressure on the inside of your foot, you're going to want something with a little bit more of a medial arch to build up that stability. One thing that you really want to be careful of if you do get fitted for shoes is to make sure that you're not being overcorrected. A lot of shoes these days have a lot of that medial stability already built into the shoe. So if you are getting more of a stability shoe, you want to make sure that you're not overcorrecting yourself, which will force you to actually supinate and put too much pressure on the outside of your foot, which can cause other problems. So if you are using a stability shoe, I recommend getting fitted at a running store. Have them analyze your gait on the treadmill, and they will fit you to the right shoe. Just be careful of not getting too much of a stability shoe if you are a pronator, and then putting arch supports in, it could overcorrect you, so just be careful with that. What the heck are we looking for when we're analyzing your gait and watching your biomechanics of your foot and ankle here in physical therapy? We're analyzing not only the shape of your foot, but how it moves as you move. Are you a heel striker? Do you hit more midfoot? Are you hitting more forefoot? Do you have a tendency to walk a little bit up higher on your toes? Do you have a foot slap, a little bit of weakness there in controlling your feet when you're walking? Do you have a shuffling gait? Are there any weaknesses or abnormalities that we need to address here? Do you have specific weaknesses or tight muscles that need to be addressed with physical therapy? Call us at Loudoun Sports Therapy Center at 703-450-4300 or click the link below.